we're about to do some Botox. So, I'm inspired. When I squeeze my brows together, it's just now coming back. I'm putting it here. I'm not doing that because I don't want to make that face. I would actually love to make this face, especially the one filming. But I'm doing it because I want my medial brow to come up some. When I squeeze, I bring it in and down, and I actually want it to come up. So I'm not going to put a lot there. You don't have to put a lot. So I'm just going to put enough right there. Well, it's hard to do that side. To where this comes up. Because when I don't have the force that's squeezing it, and by the way, I have let other people do this. They just can't do it the way I like it. And when you get that picky, you just have to do things yourself. Anyway, so that's that. So then when I squeeze in, that's going to relax. So now I'm going to do this side. Mine are different. So this is where my corrugator ends. So when I'm not bringing it in and down, then the muscle up here can pull it up. That's why you can't ever overdo a forehead. So I'm going to do this. So I can see that muscle. Mine's not that big, but some people's really is, and it's thick, especially men. This is what people mean when they feel like they look angry. Hopefully I'm not going to bruise myself any more than I've already done speak. Okay, so my forehead, I raise a little. I mean, just enough. When I start like being able to activate a Snapchat filter, I add. I don't want much. I just don't want that wrinkle right there. So I can usually see my veins. Now, people that do this, for the most part, they try to go to bone and pull back. And I just think if you don't do something to yourself or have somebody do it, if you have somebody that you think can do it well, I'm sure there are lots of people that can do it well. I just tend to pay a whole lot of attention to it. Where the vessels are, exactly how it moves. I mean, that's only 10 units in my forehead. I have a small forehead. That's all I need. If I put more than that, then I don't get as much lift. When people have a line right here, you have to be really careful. Now, here's where I really need it. And it's also the hardest place. So see when I smile, how my brow comes down? It's really unattractive, so I'm really trying to show you all this because it's important. So when I relax that, then this is going to come up. Not that high, but I can dream. So I'm going to put my finger on my orbit, and I'm going to smile. And when I do, I'm watching right where it falls down. And putting a little bit of Botox. And then I'm just doing our crow's feet. I know, somebody asked me the other day, they couldn't believe I did my own. Well, it must be so hard, but it'd be way harder to try to let somebody else do it. Because I think injectables just get overlooked. And you don't want it to be bad. To me, it can look worse than anything. Okay. Kind of hard to fish it in here still. But I can do it. So that's that. So now next time Amy does my lashes, she can make them a little longer. So that's still, I'm going to put a little bit in this end point. That's the point where the muscle wraps around. So here, over here, this one's not as bad. But see, I keep smiling. If I'm not smiling, I don't know how bad it looks. And you have to know how bad it looks to make it look better. So I'm watching right where it comes down. I put way more there. Sometimes I do it here. I don't know about the guts today.
Yeah, you do. Do it.
I'm just scared I'm going to paralyze myself.
Okay, never mind.
Well, because you can't put too much there. Yeah, I'm going to put just a little. That's where I can bleed. Now, that's like a unit. I mix it up really tight. Nobody likes this. And then you see this line on the chin? You can treat that too. This is what I can't treat. If any of y'all have that and you've asked me to treat it, I haven't done this. So that's how I can tell how much I put in. Ow. We were messing with my nose the other day. It's a little sore. So that's really it. So this is where it really needs to come down. And you got to make yourself smile because you don't want to see the line, so you don't want to do it. But that's all there is to it. Now I think Mary Peyton wants a little bit, so we may show you on her.
Yes.
Okay, any questions about Botox? Y'all let me know. I'll pull that right there. So that'll be like 12 units in my forehead. Just really because I drew up too much and it's like liquid gold.